All right, the gentleman from Maryland, Mr. Sarbanes, you're now recognized.
Thank you, Madam Chair. I just want to make the observation that Democrats don't have to convince anybody that the Republicans have an extreme agenda when it comes to these abortion bans. People are seeing that for themselves. The polling indicates that a majority of Americans don't agree with that agenda. We're just trying to bring attention to what's happening. And as Republicans have moved to implement these extreme abortion bans across the country, providers in states like Maryland that I represent that protects abortion rights have seen an influx, as you can imagine, of out-of-state patients seeking abortion care. Last year, Maryland enacted a new law that will allow more qualified and specially trained medical professionals to provide abortions. And several local jurisdictions have committed significant funds to increase the availability of comprehensive reproductive health services in Maryland. But even with these resources, providers have faced new challenges and have had to work overtime to meet the need. Dr. Verma, you provided abortion care in Georgia until the state implemented its ban earlier this summer. How did an increased number of patients from states like Texas, where abortion was no longer accessible previous to that, impact your practice before this most recent Supreme Court decision?
Thank you for that question and for the efforts happening in Maryland. We've absolutely seen this unjust patchwork of abortion bans forcing people to leave their communities and travel for care instead of being able to get that care in their own communities. And we're also seeing that that's delaying when they can get their abortion. So in the United States, 90% of abortions happen in the first trimester and less than 1% happen after 20 weeks. What delays people in getting the care that they need is when we have these abortion bans forcing people out of their communities, when people end up thinking that they're going to a health center, but end up at a crisis pregnancy center that's using deceptive practices, that's lying to them about how far along in pregnancy they are, that's tricking them into delaying that care, and then they're not able to get the care they need in a timely manner. And we've absolutely seen that.
I appreciate that insight. That's very, very helpful. The other thing I think it's important to highlight is that these abortion bans don't just impact reproductive health care delivery. They also impact doctors' ability to provide other essential health care. For example, in Texas, some oncologists have been forced to deny radiation or other treatments to pregnant women with cancer until they become even sicker, because the standard of care would then include an abortion. Dr. Kumar, what implications does this have for women's health and the healthcare system as a whole?
Thank you for that question. Yeah, abortion care is part of a spectrum of care when it comes to reproductive health care, and it's a critical part of that. I've also seen patients that have had a recent diagnosis of cancer, whether it's breast cancer or colon cancer, who are waiting to undergo treatment and are coming in for care before. Like you mentioned, their oncologist has told them that it's best for them not to be pregnant before they continue with care. I've also seen patients that have children that are undergoing care and have come in to have an abortion so that they can take care of their child, or folks that already have children in the hospital and they need to be present for them. You mentioned that this has an effect on many people throughout the healthcare system. That also includes emergency room physicians that may see increased visits from people who haven't been able to access that care, and so many other folks throughout the entire healthcare system.
Thank you. Besides increasing the health risk for patients, these bans interfere with the doctor-patient relationship and the integrity of the medical profession. I mean, it's really an affront to the medical profession. Dr. Verma, what has it meant for you to be forced to base some of your medical decisions not on the clinical needs of your patients, but on the ever-changing legal situation?
Yeah, absolutely. So we train for years and years to be able to provide evidence-based care to our patients and to be able to adjust that care to the needs of the particular person in front of us. And now we're being forced to practice in situations where the laws of our state are based on politics, not science, and are at complete odds with the practice of medicine. So instead of just being able to do what's best for the person in front of us, we're having to think about whether we're going to be criminalized, whether our licenses are going to be taken away. We're thinking about our livelihoods just for providing evidence-based care. And that's absolutely having a chilling effect on the medical profession. And it's not what people want. People want their doctors to be able to provide them the care they need without us having to think about whether our licenses will be removed.
Thank you very much. Powerful statement. I yield back, Madam Chair.
Thank you.